My name's Mitcheal, and like I said, we're from Carey. This is Erin. That's Brittany. Courtney, the videographer back there is Madison. We are bachelor students at the Carey School of Nursing. And we'll go ahead and get started.
Okay.
Yeah, today we're going to talk about having healthy skin. I know as you get older, your skin becomes dry and brittle. We're going to talk about how to take care of your skin and not make it so dry so it's not itchy. We're going to talk about pressure ulcers because a lot of people sit down too long, lay down too long, they can rub up and they can have ulcers from that. We're also going to talk about foot problems. That has a lot to do with diabetes, but none of y'all said y'all have diabetes, so that's very good. That helps your skin out a lot. And then we're going to talk about diabetic management. In case you see somebody has diabetes, you can let them know. And nutrition and skincare, about how the vitamins affect the skin differently. Okay, our goal is to have healthy skin. Our skin is durable, it's pliable, and it's strong enough. It needs to be strong enough to withhold wear and tear. Like if you rub up against something, it shouldn't break. And if you bump into something, we're going to try not to make it bruise and scratch so easily. But it also needs to be very sensitive, so when you touch something, you can realize if it's hot or if it's cold or if it hurts or if it's okay. And because it is the largest and most exterior organ of the body, we need to keep it as safely as we can because the skin keeps us from getting inside damage. It helps us keep getting inside damage is bad. And this presentation will inform you on how to care for your skin.
Okay, I'm going to talk about reasons that we get dry and itchy skin and some ways to give you some relief for that. So the first thing, not drinking enough liquid. I know it's hard sometimes with the way your body changes, you don't feel like you need to drink as much liquid. Spending too much time in the sun can definitely cause your skin to become dry. Smoking, increased stress, diminished sweat and oil glands, which is a normal change that occurs with aging. It happens to all of us. If you use too much soap, it can actually hurt your skin worse. Too much antiperspirant or perfume, taking too hot of baths. If you have kidney disease or diabetes, that can cause your skin to be dry. And the skin has a decreased ability to retain moisture, to control temperature, and to sense the surrounding environment as we get older. Okay, and some relief for dry skin. You can use moisturizers like lotions, and we actually brought some today to pass around for anybody who wants to use some. Take fewer baths and use milder soaps. Do not add oils to your bath because it's going to make that water really slippery and it can cause you to slip and fall in the bathtub. And try using a humidifier, which is something that you can put in your room, and it's going to add moisture to your room to help your skin stay moist.
Alright, so this is a topic that's pretty common, assisted living facilities and stuff like that. You guys can pretty much get up and get around, so it's not as common. Pressure ulcers, which the layperson term and the common term is bed sores. They're defined as a result of injury to the skin and or underlying tissue resulting from pressure or in combination with shear, usually over bony prominence. Basically what that means is the tugging and the pressure on the skin sitting in awkward positions too long. If you're laying on your back, kind of sliding down, it puts pressure on your butt area, stuff like that. It can develop anywhere on the body. Most commonly the sacrum, heels, elbows, hips, ears, and shoulders. The sacrum and the heels are probably the biggest ones. Sacrum can develop from sitting down or from laying in the bed too long, hours at a time. And the heels too, once again, if your wheelchair setup's not proper, or if you're laying in the bed, your heels laying down can cause that breakdown. I'll get to that in a minute. It's influenced by moisture, the amount of pressure, the amount of friction, and shear. And shear is basically like a sliding type force, Primary factors, risk factors for pressure ulcers are immobility and limited activity, which I said. And here's like a little diagram of it. You can see the sacrum in the heels when they're laying down, the elbows, back of the head. Down here, the ear, shoulder, hip, knee, and it's pretty self-explanatory in a lot of ways. If you stay in one spot for a long time, it puts pressure in all the parts that kind of poke out, the bony areas. And if you do that for too long, it decreases blood flow to there and you have skin breakdown. Also, those of you that may spend a lot of time in a wheelchair, you're no different. Staying seated like that for a long time, you still get that sacral and that area around your butt that can break down your elbows and then your back. You good? Common foot and foot problems and appropriate treatment, corns, calluses, results of prolonged pressure. Usually what this comes from is improperly fitted shoes. You can see the corn here. Corns are typically, with what I'm familiar with, is on the toes, and a lot of you may be. Calluses on the bottom of the foot. That's from like repeat or chronic pressure. Appropriate treatment, padding and protection of the affected area with oval corn pads or moleskin. Notify your nurse. I asked y'all earlier if we had any diabetics, because everything we're talking about today, diabetes compounds, and if you're diabetic, you can't manage your own foot care. You can, but they're not going to recommend it. You need to have a podiatrist or a nurse do it, because with diabetes, if you nick your skin, if you cause some form of injury, that can cause a major infection, which can actually result in amputation. So we try to avoid that. Inappropriate treatment, removal of razor blades and scissors, over-the-counter treatment that can burn the skin. And that's, when they say the over-the-counter treatment, that's like a little,
It's like the wart.
Dr. Scholl's. Dr. Scholl's makes it. It's like a little thing that freezes the corns off and all that. Yeah, that's considered inappropriate, because that's going to freeze it, and that's essentially a burn. And when you burn the skin, that puts you at risk for infection and stuff like that. So they don't want you doing that, which can ultimately result in that amputation. You good? Bunions, bony deformities that also develop from long-standing squeezing together of the first toe and the second toe. Basically, if you have shoes that squeeze your big toe inward, you'll eventually develop this. It angles it, and this is the bunion up in here. It's characterized by stiffness and pain in that joint. And really, the only real treatment for it is just custom fit shoes and notifying your nurse if you have any discomfort, and they'll help you with that. Fungal infections are pretty common too. Then maintain dry and clean feet. Regularly expose the feet to the sun, even though we told you not to do that earlier. Just not for long periods. And notify the nurse of discomfort. So basically, if you sweat a lot or you feel your feet getting moist, try to air them out. If you're outside, take your socks off, spread your toes out, relax for a little bit. You're good.
Diabetes management for skin health. With diabetes, you have an increased blood sugar, so that would cause decreased blood flow to your arms and legs, causing increased risk for infections and dry skin. We need to make sure we monitor our blood sugar frequently before we eat, in the morning, at night, rotating sites, avoiding foods with high sugar content, and making sure we take care of our feet. With nutrition, these vitamins, vitamin A, C, D, and E, help with vitamin A, cell growth, wrinkles, and hydration. A lot of the orange foods like sweet potatoes, carrots, mango, it might not be on there, cantaloupe, bell peppers are great sources of vitamin A. For vitamin C, it's great for collagen synthesis that helps your skin's strength and structure. Some foods are fruits, citrus fruits, kiwi, broccoli, and berries. For vitamin D, you can get that from the sun, like just walking outside for about 15 minutes a day or 30 minutes a day, and it promotes wound healing and UV protection. For vitamin E, it blocks free radicals in the body, decreasing the aging process, so it'd be really great. Good sources of vitamin E are sunflower seeds, almonds, spinach, avocados, and shrimp. Protein helps with wound healing and collagen formation, as well as the immune response. Good sources of chicken, turkey, eggs, nuts, beans, or yogurt. And definitely need to get about 8 glasses of water a day, or even more, to help your hydration of your skin. And zinc helps with collagen formation, UV protection, and some forms of zinc could be in oysters, beef, and veal liver.
And going back, talking about the pressure ulcers and the bed sores earlier, your intake of protein can directly affect that. If you get to where you spend a lot of time in the bed and things like that, or in a wheelchair, if you can talk to your staff and increase your protein intake, it'll help prevent that. It'll help the healing process and help prevent it.
Yes, ma'am, and take a water.
There isn't anything up there about how good flaxseed is for you.
Flaxseed?
Flaxseed.
Flaxseed has omegas in it. It's going to be somewhat, go back real fast, Madison. Go back that way. Like, go back towards the, flaxseed is kind of, it helps with, let me think. It's your omegas, like your fish oils and stuff like that. The benefit that you will get from salmon, besides like the protein, it helps with skin healing and skin moisture and stuff like that. You have to refer to like your doctor and, you know.
I just use it ground up.
You use it ground up and put it on your skin? I've never heard about that.
Okay, yes, ma'am.
Oh, yeah, I just push it like this.
Okay, yes ma'am. The flax is a
That
good
sounds
source-
good, thank
good
you.
source of omega-6 and omega-3. I know that. There's also supplements you can buy, like liquid supplements and stuff like that I'm familiar with. It's very similar to nutritional supplements, except it doesn't come from fish, it comes from
I can't see, I hadn't got my glasses.
Okay, okay, so for our speech, we're rating 1 to 5.
Well, also,
Presence,
I do put it on, but I wear
interaction
We
with
get
kids,
10?
Yeah.
and
Five.
We're at 11.
clarity,
Okay.
so,
So you're right.
organizing,
Yeah.